strength. And Lord, as we meet, we want to do all things orderly and honorable before you. We also pray, God, just give us a peaceful day tomorrow in our city. Watch over our community. And for those going through this health crisis, we pray for our whole community. Lord, strength and healing, your protection. In Jesus' name, amen.
Amen.
All right, I will call the Tuesday, Monday, November 2nd, common council meeting to order. Elissa, will you take the roll, please?
Cash. Went.
Here.
Britton.
Here.
Barth.
Here.
Holthouse. Wagner.
Here.
Schmidt.
Here.
Wetzel.
Here.
Hill.
Here.
And if you would please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And then Carol, Craig, and Rose are on remotely. All right. Our first item then is the minutes of the council meeting from October 20th. Does anyone have any questions or comments on any of those minutes? All right. Next is comments and suggestions from citizens present. Seeing none. We have no public hearings. So then the next is committee reports. We have Finance Committee from October 19th, 21st, 26th, and 27th. Plan Commission from October 26th, and Public Safety and Welfare from October 14th. Any comments, questions, corrections to any of those minutes? All right, very good. Communications and recommendations. The first one for you all to please consider are appointments for poll workers and the Board of Canvas members.
I'll make a motion to approve appointments.
I'll second that.
Motion by Ritten, second by Wagner. Any comments? All those in favor, please say aye.
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 Any opposed?
Abstain.
Thank you.
Aye.
Oh, hey, Tom.
There he is.
Where did he come from?
Forget my delay. I was having trouble with go-to meetings, but I had to dial in tonight.
All right, I will remember to wait a few extra minutes.
Thanks.
All right, next is appointments. We have appointments for your consideration for the Historic Preservation and Downtown Design Commission, the Licensing Board, Park and Rec, and Plan Commission.
I'll make a motion to approve those appointments.
Thank you. Motion by Ritten. Seconded by Schmidt. Questions, comments on any of these? All those in favor, please say aye.
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 Any opposed? All right, very good. The next is a disallowance of claim by Shirley Bauman. Is this an FYI? We're formally voting. You want a roll call or voice? I didn't ask. Roll call. Okay. So I would look for a motion on this item.
I'll motion.
So move to approve for the disallowance.
Yes,
Okay.
sorry.
Motion by Wetzel,
Yeah, I'll second that.
seconded by Ritten. Questions? Elissa?
Wetzel.
Aye.
Hill.
Aye.
Cash.
Aye.
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
Schmidt.
All right, our next item is our COVID-19 discussion and update. Carol is with us tonight. Carol, can you see the screen okay?
Yes, I can.
All right, very good.
So I will update you on our local numbers. We've had 8,470 total investigations. We have a total of 915 confirmed cases, and 5% of our positive cases have been hospitalized. 6,991 are not a case of the previous 8,000 number. We have had 757 individuals recover, and we have 232 open contact investigations. We continue to have 8 probable cases, and we have 327 suspect cases that we're following. And then on the next slide is an update of our graph that we post every Monday and Wednesday. So again, just recapping the numbers that I previously presented, we have a total of 915 total cumulative from the beginning positive cases. 757 have recovered, and we actively have 158 positive cases. And then the next slide. This next slide just gives you, and I've shared this slide presentation with you before, it gives you a picture of number of positive tests per day, and you'll see the 2 days, October 17th and 18th. That was when the statewide electronic medical record was down, and then the day following that with the increase in cases. So you can see since that time frame where we had that significant number of cases, we continued to have active daily cases. And then age breakdown, this is a little different presentation, but it breaks down the number of positive cases by age range. And you can see that our 20 to 29-year-olds are still the most impacted age group in our community. And then the next slide, we have had community members interested in the impact on our pediatric population. So we broke down the younger age group a little bit further for your information, and you can see that the 14 to 17-year-old age pediatric population has been most impacted in our community. And then the next slide is our Wednesday presentation. This reviews all of the data from the previous 2 weeks, but we update it every week, and it gives a picture to our community about different metrics that we're measuring. These metrics have been the same. So we're measuring percent positive, a total number of cases, cases per day, resource or capacity for testing, treatment without crisis, positive healthcare workers, and then the trajectory. And then the next slide is just the definition that goes behind each of those metrics. And I wanted to share with you that today was a very busy day. We had 47 positive cases when my staff left at 5:30 this morning, or 5:30 this afternoon. It feels like this morning, feels like I haven't left. And I just looked on our staging, and we have several more cases. So I've been here calling, and it's been busy. We have active disease in our community.
I'll go through my list, and then we can take questions if anyone has any. In that, kind of in that frame of mind that Carol just shared, you may have seen the press release that we put out late last week, and I sent it to you all as well, about the shift from responding in 24 hours to 48 hours. So we made that change last week. At that point, we were just under 17 cases, I think, per day. So we waited as long as we could on that one before making that adjustment. I spoke at the last meeting about working with the CDC on requiring some testing machines. We have been working with 2 local healthcare providers who have family-based clinics that have helped us with some testing here and there to utilize these machines. So we're working to get those into the community so we have another opportunity for testing. And then we've been working quite diligently with the consultant that we have for just a handful or so hours a week to update the phased reopening plan. That plan will come out on Wednesday. So we'll have that to provide to everyone. Updates on the use of CARES money. Some of these may teeter into the emergency order because it would be over $10,000, so I'm just kind of clumping that all together. We were at what we know so far is we were at the last period of purchasing using the CARES money for reimbursement. The governor's office called me last week and did indicate that there could perhaps be an extension of that time frame. We're not going to plan on that. We'll see if it actually happens. So we planned to spend out the best we could within the guidelines and within our needs, the funding that we had from CARES. We did that with PPE purchases, so we purchased some KN95s. We purchased a wide variety of cleaning supplies, everything from the spray and the cloths you see in this room all the time to Clorox wipes if we could get them, to the hand sanitizer refills. We've gone through everything that we normally keep on hand for those Purell dispensers. An electrostatic sprayer, which is a fogger for a room like this after we're all in here for a few hours. Not today, though. And then the disinfectant for that sprayer. And then I think I've shared this already, but we did kind of a survey of all of our buildings to get the touchless faucets. So that's all CARES reimbursable. We also did some retrofitting of a new conference room downstairs that's now like a bona fide conference room. So if you're a chair, 0041 is going to give you better spacing than 2044. This room's virtually not usable at this point in time. So if you need a room, 0041 will have tables because it didn't have any, and then we're working to get a conference phone down there, and then we'll be able to check out. There will be one of these cameras upstairs and one downstairs, and we'll check those out so that people have the resources that they need for the rooms downstairs. So you can tell in this room and all across City Hall, we being the clerk and her team have been doing a lot of prep for the election. We will be doing our best, given the crowds and given the potentiality of having observers in the room as well, we'll be doing our best to be socially distanced. Some of the rooms are, this is probably the biggest one, with the exception of MATC and maybe Conley Hall. So there's a couple of rooms that are half the size that will have voters going through them. So we have a plan for cleaning throughout the day. There's a cleaning service that will be coming and cleaning the booths. We have PPE for the workers. Where we can't be 6 feet apart, the workers will be asked to wear a face shield and a face covering. And we are going to do our best to keep people moving in and out at a safe pace as best we can. We have a lot of new people assisting this year, obviously. We've had this question. It's not necessarily germane to COVID. People, are we concerned about unruly polls tomorrow? No. Are we prepared? Yes. I think that's a fair assumption, right, Chief? We hope we don't have to use that preparation, but we should be okay. Building updates for everybody. So the health department remains closed to the public except via appointment, which they have done appointments for immunizations, medicine, certain drop-offs, car seat checks. So that remains the same. We had a leadership team meeting on Monday, and we are going to, given obviously what Carol just shared too, we are going to remain closed on Tuesday and Thursday. We have been open on Tuesday and Thursday for voting. And when it comes time to collect property tax payments, we'll probably do the same. We'll probably have hours where people can come in on those 2 days. The reason I share that with you is because we are not immune to this virus as a city team. I was just chatting with one of my team members, and since last week I've had at least a couple every day. Before I'd have like a couple a week probably, and now I've had 5 days in a row here, including the weekends, of at least a couple people every day. And they're all across our city team. So we provide, as you all know, essential services, and it's chiefly my responsibility to make sure we can provide those. So I'm carefully watching our numbers to see if we need to make adjustments, if we need to be doing staggered shifts in the office or what it may be. We obviously have made some building improvements. We've spaced people apart as best we can, but just so that you're aware, we do have cases and quarantines kind of sprinkled throughout all of our city departments. We continue to hold the line on face coverings and distancing. You can ask my team. I'm probably a broken record about it, but it's critical to keeping people as safe as possible, and especially where we've had people coming up positive. Not riding around in a truck together is going to be one of our strongest approaches to keeping people as healthy as we can. So those are the updates that I have. Who has questions for me and or Carol? Chris?
I have a question for Carol. Maybe you can tell me, maybe you can't, about the influx of positive cases. Are we able to tell what the lowest common denominator, like where are these people getting infected? Is it like, are they going to weddings or school related, or is it just we can't tell, or is it just a little bit of everything?
It's a little bit of everything. I interviewed several people this afternoon and into early evening before this meeting, and it really is a little bit of everything.
I think this week, Carol, do you want to provide just an update on our schools generally? I mean, you may have, some of you probably know. So the middle school went virtual this week. St. Henry's is closed. The third.
The older classes.
Yep.
Yeah.
Which I think is all of what St. Henry's is. We have a third grade classroom at St. Bernard.
Right.
Good Shepherd
Right.
has been closed. I think this is the second week. And then we have, a go ahead, you know them better than I do.
That's pretty much the list. And then we have a couple classrooms closed across the district.
Elementary level.
Yes. Mhm.
I mean, the quarantines there is what is a tough one.
I just have some context. I've been doing research in this very intently in regards to people who have published papers within the medical community, both domestically and internationally, to get a better understanding of what the coronavirus actually is. So the specific case that we're dealing with is SARS-CoV-2, which is COVID-19. But that's also part of the coronavirus family, which has 7 main viruses within that family, 4 of which are tied directly to the common cold. Then we have SARS-CoV, and then Mers-CoV, which is both SARS-MERS. I did some research into those. I have my notes on those in regards to similarities between MERS and SARS. The big difference, their compatibility is the bats were the reservoir, and they're both targeting the lower respiratory facets of the human body. What makes SARS-CoV-2 or COVID-19 different uniquely is that it targets the upper and lower respiratory functions of the human body. So that's one of the new characteristics. They believe it's to be zootonic, big thing on there. But the big thing I discovered in my research, which was the most current article I found was in July of this year, is that the CFR or casualty fatality rates globally are only 2 to 5%. And the infection fatality rates, or IFR, are 0.3 to 1%, which are far lower than any estimation that was given initially. And these are as of July, so these are some pretty recent numbers. What they've also discovered is the current testing methods targets the viral particles to hit a positive test result is only 100. And this is the noxilent viral particles that it tests, which is a significantly lower number. What they've also found that can trigger a positive result are those who already have immunity through, I'm going to butcher this, humoral immunity attributed to a form of plasma, which will test positive for immunity from previous exposure to different coronaviruses within the same family tree, or T-cell immunity. And that study has been replicated initially in North Carolina back in May, and it was also replicated in Germany, Singapore, and the Netherlands with similar results, where they tested patients who had recovered and tested positive since the pandemic started. Additionally, they tested the same number of plasma donations from 2015 to 2018 with a staggering 40 to 60% immunity rate when they introduced the virus into those samples. So on a conservative estimate, they're saying 50 to 80% population infection rate globally, you have herd immunity. On the low end, 20 to 40% immunity, plus those who already have T-cell immunity equals herd immunity. So the condition that we're seeing, an increased spike in testing, could be attributed to the hypersensitivity of the test hitting people who already have asymptomatic symptoms because they already have immunity, so it's going to pop positive on the test because it doesn't distinguish between the two. And the fact that we're coming into cold season and you have 4 strains of the coronavirus that affect the outside of the virus is almost identical. And so it's going to replicate that same symptoms, and it could be a false positive. And that's been something they're digging into, and some of these studies, even in the attribute of the doctor who was publishing this, said they're being overlooked. And that's a concern to get accurate testing from a medical standpoint. So I think that could be a contributing factor to the instant spike we're seeing is contributing coronavirus family issues, not specifically just COVID-19 because the test is hypersensitive and it is testing people who already have immunity. And that's a challenge with the testing procedures we currently have in place, along with the antibiotic testing that goes with that.
Any other questions or comments? Anything else, Carol? All right. Oh, Tom, were you raising your hand?
Just a quick question. This is more high level. Are we going to, probably right now, logistically, it's not feasible, but are we going to be providing any antibody testing, or has that been a discussion for those maybe asymptomatic or those people that think they may have had it, but they didn't seek medical treatment? Or is that, I know right now, I think it's through giving blood, they do an antibody test, but is there any other method to do that?
So we have had individuals in our community that, for a variety of different reasons, needed or requested an antibody test and have received that.
Okay, so it is available for those that may need it.
Yes, it is, and has been.
And you may have already touched on it then. What is the capacity at the hospital right now? Are we flirting with dangerous levels of capacity?
I don't want to speak on behalf of the hospital, but I will tell you, we work with the hospital. We have a conversation every day, and they are reporting through a state reporting system, and that's where we pull our data. They have had some tight staffing along the way over the last couple weeks, and our other healthcare facilities, so our nursing homes, are also being challenged with staffing and capacity. So I'm working with them every single day to develop a, actually I've assisted one long-term care facility to put out a statewide call for additional help, nursing help. And, you know, our community is being impacted like many others across the state with staffing and capacity, and being creative with, you know, making sure that we're able to care for our individuals here in this community.
I'll just add to that, Alderman Pash, Richard Keddington is the CEO of the hospital, and they've made a concerted effort to provide more information about the current situation at the hospital and proactive steps people can take. So I would encourage everyone to like them, follow them, watch those updates. In one of those updates, so I'm not speaking directly for the hospital either, but in one of the updates, he did say, he did speak to, you know, before they were at like 3 or 4 cases a day. They've had some days where they're at 13. They're averaging closer to 8 to 10. We did send patients to the field hospital at State Fair Park. So I think that, I mean, I know I've also heard them say that that capacity changes hour to hour. So it's difficult to broad brush that answer, which is why I appreciate Richard's effort to provide something even after, like, let's hear it the week after then, just so we have some idea of where we are. So he's made a really, they've done a really good job of providing updates there, and I think it's a good spot for people to get information. I think they're doing a video every other week, and they have a lot of other info there too.
Thank you.
Anything else?
Just a positive note to end on is that the thing that he stressed through all the research I found is the key to fighting this off is being healthy, and he recommended exercise, eating right, getting proper sleep, stress reduction. He recommended avoiding the consumption of tobacco in any form, and stressed that if you're going to drink, do so in moderation because it can impact the immune system, and that's the biggest contributing factor. That's a wild card in all these cases, is immune systems being compromised because of poor health or poor diet or lack of exercise. And that's where he stresses that's the best thing we can do to help fight this off if we get it.
Any other questions, comments? Anything for Carol? All right, Carol. See you later. Okay, thank you. We have no new business, and then the accounts payable.
I'll make a motion to pay all accounts payable.
Motion by Ritten, seconded by Barth. Comments or questions on any of the accounts? Elissa?
Britton,
Aye.
Barth,
Aye.
Holthouse,
Aye.
Wagner,
Aye.
Schmidt,
Aye.
Wetzel,
Aye.
Kilps,
Aye.
Pash,
Bye.
Went,
Aye.
All right, next is reports of miscellaneous business. We have Library Board of Trustees from August 13th, 25th, and 27th, Park and Rec and Forestry Commission from October 5th and 14th, the payroll summary of September 23rd to October 6th, and site plan review from October 26th. Comments or questions on any of those? All right. Then we have no licenses, and let's go to ordinances. Our first is ordinance 20-25. This is to amend chapter 550 of the zoning code through the creation of section 550-112D, exceptions to noise standards. This is here from me and the Plan Commission on its second reading.
Mayor, I'll make a motion to approve ordinance 20-25 on its second reading.
Motion by Britton,
I'll second.
seconded by Went. Questions or comments? All right, Elissa.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
Cash.
Aye.
Went.
Aye.
All right, next is ordinance 20-26. This is to adopt the plan unit development, general development plan under section 550-152 for O'Connell Street. It's here from me and the Plan Commission on the second reading.
I'll make a motion to approve order 20-26 on the second reading.
Motion by Went,
I'll second that.
seconded by Britton. Questions or comments on this one? Melissa?
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
Cash.
Aye.
All right, next is ordinance 20-27. This is to amend section 512-87, water lateral connection of chapter 512, water and sewer, articles, 6, water and sewer lateral control of the city of Watertown general ordinances. This is here from Alderman Pash and Public Works on the second reading. Stop laughing.
I'll move to approve ordinance 2027 on second reading.
I'll second.
Motion by Pash, seconded by Holthouse. Was I at least right?
You nailed it. You got it right last time,
Just
too.
not with a lot of confidence. I should really look at these before the meeting.
I just want you to listen to, write it
Yeah.
in there how you said it.
Any questions or comments on this one? All right, Elissa.
Cash.
Aye.
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
All right, next is ordinance 20-28 to amend section 147-10, auxiliary police of chapter 147, police department of the city of Watertown general ordinances. This is here from Alderman Schmidt, public safety, on the second reading.
I'll make a motion.
Motion by Schmidt,
Second.
seconded by Wetzel. Questions or comments on this one? Elissa.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
Cash.
Aye.
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
All right, next is ordinance 20-29. This is to amend section 390-11K, definitions of chapter 390 nuisances, article 2, chronic nuisance premises of the city of Watertown general ordinances. This is here from Alderman Schmidt and public safety, second reading.
Make a motion to approve.
Motion by Schmidt,
I'll second.
seconded by Went. Comments or questions? Melissa.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
Cash.
Aye.
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
All right, resolutions. Our first is Exhibit 9107. This is a resolution to authorize interim classification and back pay for Jay Habercorn. This is here from me and Park and Rec.
I'll make the motion to approve.
Motion by Schmidt, seconded by Wetzel. Any questions or comments? Elissa.
Schmidt.
Aye.
Wetzel.
Aye.
Kilps.
Aye.
Cash.
Aye.
Went.
Aye.
Britton.
Aye.
Barth.
Aye.
Holthouse.
Aye.
Wagner.
Aye.
Next is Exhibit 9108. This is a resolution to recognize the retirement of Jay Habercorn from the street department. This is here from me.
I'll make the motion.
Motion by Schmidt, seconded by Bartz. Questions or comments? All those in favor, please say aye.
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 Any
Aye.
opposed? Sorry, Alderman. Next is Exhibit 9109. This is a resolution to update the 2020 payroll resolution, Resolution 8915, to adjust the pay grade for the Information Technology Coordinator from grade J to grade K. This is here from me and the Finance Committee.
I'll make that motion.
Thank you. Motion by Wagner,
I'll second that.
seconded by Written. Questions or comments? Elissa?
Wagner,
Aye.
Schmidt,
Aye.
Wetzel,
Aye.
Phillips,
Aye.
Cash,
Aye.
Went,
Aye.
Written,
Aye.
Barth,
Aye.
Holthouse,
Aye.
All right, next is Exhibit 9110. This is a resolution to approve the preliminary plat for Grandview Heights subdivision, Edition 7. I literally just said, oh man. This is here for me and the Plan Commission.
I'll make a motion to approve 9110.
Thank you. Motion by Wen,
I'll second this.
seconded by Written. Any questions? Comments? Do you want the roll? Okay, all those in favor, please say aye.
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 Anybody opposed? Right. And then our last one this evening is Exhibit 9111. This is a resolution for the designation of an authorized rep to file applications for financial assistance from the State of Wisconsin Environmental Improvement Fund. This is here from Alderman Pash and Public Works.
I'll move Exhibit 9111.
Motion by Pash,
I'll second.
second by Holthouse. Comments or questions? Are you fine with voice? All those in favor, please say aye.
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 Anybody opposed? Our next item is comments and suggestions from citizens present. Seeing none, I would look for a motion to adjourn.
I move to adjourn.
I'll second.
Motion by Written, seconded by Schmidt. All those in favor, please say aye.
Aye.
Anyone opposed? All right, thank you, everybody.
Real good, team.
How are you doing?
Pretty good, how are you?
Good. Had a couple.